the major zoonotic diseases which are transmitted from sheep and goats. If you see the array of etiological agents, there are several. So depending on the route of transmission, you have anthrax, brucellosis, leptospirosis, contagious ecthyma, mange or scabies, dermatophytosis, tularemia, CCHF. These are the ones which can get directly transmitted either with the live animals or tissues or excretion of sheep and goat. And from the oral route, you have mainly the anthrax, brucellosis, campylobacteriosis, E. coli, salmonella. Mostly these are the foodborne or fecal-oral route of transmission. And from the inhalation, we have anthrax and Q fever. Vector-borne diseases are Lopingan and Rift Valley fever. So vector-borne zoonotic diseases are important because it is said that almost among the total infectious diseases which are present, it's almost like 17 to 20% are vector-borne. So, but we'll not be covering all. It's only the major zoonotic disease like which is listed in the left, we'll be covering it today. The first disease, the major disease which is prevalent in sheep and goat and of zoonotic importance is of anthrax. So you all know the etiology. So Bacillus anthracis is the causative agent, which is a gram-positive bacilli. It's anthrax is, as you know, it's mostly, although it is seen in other parts of the India, it's mostly enzootic in southern India with the regular outbreaks in sheep and goat and in cattle, buffalo as well. Infected animals usually shed this bacilli through oozing of blood. So when they die, animals will excrete either blood tinged or the unclotted blood through natural orifices, which will subsequently become the spores in the environment. And these spores are the ones which are very markedly resistant, and it has been shown that they several decades they will remain in the soil and they remain infective. That's what is important. And more importantly, in spite of being enzootic, this anthrax has a potential bioterrorism agent. So we all know that in the 1990 and 1999 and 2000, the episodes of spreading of this anthrax spores through envelope in USA. So several people affected and there was casualties as well. So it can be easily even turned into a bioterrorism agent because spores are very resistant to different environmental conditions. And again, when it comes to risk category, Bacillus anthracis is risk group 2 as per the DBT if you are handling in laboratory for the purpose of laboratory biosafety. This is the distribution of anthrax in livestock, both cattle, buffalo, sheep and goat in India. So as you can see, mostly it's in the tri-junctional area of the 3 states, mostly the Karnataka, Andhra Pradesh, Telangana, and the Tamil Nadu. Here is the one which you see the most number of anthrax cases and outbreaks every year. Of course, the states are like West Bengal, Odisha. In certain part of probably Assam also this has been detected, and even in Gujarat as well. But although there are a good number of cases has been detected in animal cases have been detected, human cases mostly are reported from either from Odisha and West Bengal, probably Telangana. I'm not aware, but these are the 2 states which from which human cases of anthrax are being reported because of consumption of anthrax affected dead animals. Transmission again, in case of animals, it is through ingestion of food and water. The soil which is contaminated with the spores of the anthrax bacilli. See, what happens is most of the times whenever the animal, especially sheep, goats, small animals, small ruminants, they die, the shepherds, they may not dispose it properly without proper burial or without following incineration. So when they dispose it in open, bacteria will remain for the long time in the form of spores. So when a next flock or a migratory flock will go for a grazing there, again they get the disease. That's a more important factor in case of transmission in animals. When it comes to humans, the 3 very well established routes are there. First one is through ingestion. So whenever the animal dies suddenly, people will have a certain category of people will have habit of eating it, those infected animals. So, and again, contact with the infected animal and animal products. Especially like meat, wool, and the carcasses. And next is through inhalation of spores. This is mostly in industrials like the wool industry and leather industry, where they process the wool for the production of the cloth or rugs and other things. So high risk groups, who are all are at higher risk of contacting anthrax. First of all, as I told, it's a zoonotic disease and livestock disease. Definitely livestock farmers are the are highly susceptible for the zoonotic disease like anthrax. And again, those people who work in slaughterhouses or the meat processing industries, and those people who work in tanneries, in the skin processing industries, and again vets, as we are involved in mostly giving healthcare of animals. Vets are again at the high risk groups. Again, laboratory personnel, so wherever the samples which are suspected for anthrax are being handled, or the cultures of anthrax being handled, they are at higher risk group. And again, military personnel, because I told it's a bioterrorism agent, so this agent can be used to wage war against other countries. So in such cases, military personnel may be are of higher risk of getting this disease. In clinical symptoms, vets know very well actually. In ruminants, usually the disease occur as acute or peracute form. Initially, they may show fever, but before death, they may show prostration and convulsion. In certain cases, there may not be any signs. Again, there will be sudden death in maybe in hour or two. So after in the post-death, usually the symptoms which we appeared is the oozing of either unclotted blood or some the blood tinged fluid from natural orifices. That is what is the way of contamination of soil actually. That is in case of small ruminants and large ruminants, but in pigs and carnivores also the disease can be seen, but it's not of that fatal. But the most common symptoms in case of other animals will be since it's a oral route of the transmission in animals, the neck and the pharynx is the inflammation can take place. Again, there will be the lymph nodes of the mesentery may be affected. So this is about the clinical symptoms about the anthrax in animals. Coming to anthrax symptoms in humans, I told it's either through contact with the carcasses or the animal products, or the inhalation of the spores, or through consumption of infected meat. So first, if you see here, this is how the symptoms can take place if a person handles the carcass of anthrax affected animal. So this is the cutaneous form of the anthrax. Usually whenever there is the cut or ulcers on the skin, so that gets contaminated with the anthrax bacilli. So there is a local inflammation takes place wherever there is cut, or the part which has come in contact with the anthrax affected animals. So you will see initially it will be like a small papule, later it ruptures and becomes a vesicles and papules. So this form of the black color which develops is the characteristics. The skin lesion is called eschar skin lesion. So and there may be low grade fever as well. So this, as I told, there are three different forms: cutaneous form, inhalation, and intestinal form. Cutaneous form is the commonest form which is seen in anthrax. Next, again, inhalation anthrax, as I told, sometimes the shearing of the wool or during the processing of the skin, so the aerosolization of the spore can take place. So when people inhale those spores, so the inhalation form of anthrax will exhibit it. So, but as you see, the inhalation forms, the frequency is less, but this is a more severe form compared to the cutaneous form, because so here the lungs are affected, so the people will get difficulty in breathing. So and again there will be mediastinal widening in those people who are affected with inhalation anthrax. And again the third form, intestinal anthrax. So as the name suggests, it's mostly through consumption of infected meat. So whenever there is the sheep and goat, or even for that matter cattle dies, people may harvest that meat and they may eat without proper cooking. So that leads to the intestinal form of anthrax. So as I said, it's intestinal problem. The most common the symptoms will be gastroenteric type of symptoms like fever, the bloody diarrhea, vomition, and even it can be fatal in case of untreated cases. So again, samples if you want to collect for laboratory diagnosis, especially for vets. So from animals, usually you may not find a live animal at that time. The veterinarians visit, the animal might have died. So most commonly, either you can collect blood or the swabs from any of the natural orifices from where the blood oozing. In case of humans, the collection of the samples depends on which form of the disease it is. If it is a septicemic or intestinal form, you can collect blood and stools. So if it is the cutaneous form, the skin ulcers ulcers or the scabs or even the swabs from the ulcers can be taken. And if it is of cutaneous or sorry, the inhalation form, the lungs sputum can be connected. Again, in the environmental sample, sometimes, as I told, because of the oozing of these unclotted blood from natural orifices, the environment get contaminated. So even the soil sample where the animal has died, maybe around 50 to 100 grams from the soil samples also can be collected for the detection of anthrax bacilli. The laboratory test which the diagnostic laboratories use to diagnose anthrax are first of all the staining methods, isolation, serological test, and PCR for the final confirmation of the bacteria. In the prevention and control, as I told, mostly the disease spread if through improper disposal of carcasses which are affected with anthrax. So the first and foremost, the farmers has to be advised so not to throw the carcasses, and we should guide them for proper disposal methods like burial or incineration. Incineration is the best, but the amount of the material required, like the wood and kerosene, petrol required, will be too high. So if it is possible, it's better. The best is incineration. If it is not, the deep burial where the people or the animal doesn't go. Second one is the consuming meat of skinning or evisceration of anthrax suspected animal must be avoided. Again, disinfection of carcass and surroundings. The recommended ones are 10% formalin and 4% glutaraldehyde. And again, vaccination of healthy animals in endemic areas, because according to states' policies, it's not generalized vaccination, blanket vaccination for all. Only in those places where the anthrax cases of animals are repeatedly seen, usually on those places, the vaccination is done for the animals, so that it has to be annual revaccination should be continued. And if you are more interested, it's better you should consult a standard operating procedure for anthrax, which has been prepared and released by ICMR. So a very good resource about the samples to be collected for laboratory diagnosis, laboratory diagnostic procedures, and guidelines for decontamination and disposal of anthrax has been very well described in this document. Second, brucellosis. So no much introduction is needed about brucellosis. They're very well known, very endemic disease in almost all states of India. So brucella is the causative agent. There are presently 12 species of brucella are present. But if you see the zoonotic potential, it's of mainly three zoonotic brucella species: Brucella abortus, Brucella melitensis, and Brucella suis. Brucella abortus is mainly infects cattle and buffalo. Brucella melitensis mainly infects sheep and goat, and Brucella suis infect pigs, and Brucella canis in dogs. But there are reports like even the Brucella abortus in sheep and goat and melitensis in cattle as well. Pigs may be again infected with both Brucella abortus and melitensis, but mostly the major the hosts are cattle and buffalo for abortus, sheep and goat for melitensis, and pigs it's for suis. So again, risk groups too, if you see, if you're handling Brucella agents again in laboratory, or if you're culturing it in larger quantity, it is said that BSL-3 has to be used. For general purpose Brucella, risk group 2 itself would be sufficient. And again, brucellosis in small ruminants. So brucellosis in small ruminants is a significant problem actually. Brucella melitensis in small ruminants, as I told, in small ruminants, like in sheep and goat, the main zoonotic brucella is Brucella melitensis. Otherwise, in case of sheep, in rams, Brucella ovis is also cause of brucellosis, but that is not the main zoonotics species. If you see the Indian scenario, actually, national level, actually our own institute, ICAR Nivedi, has conducted national level sero surveillance to identify the seropositivity in sheep and goat. So according to that, we have in sheep it's almost like 11%, and in goats it's around 5% seropositivity has been detected at national level. So accordingly, they have also identified some of the risk factors as well. And again, females have a higher seropositivity when compared to males as per that. And Brucella itself causes huge economic impact because of the abortion, infertility it causes in cattle, buffalo, sheep, goat, and pig. Major share of this economic impact is in from cattle and buffalo. Sheep and goat brucellosis also contributes almost like 3.5% to the total economic impact. So this is again a study conducted from Nivedi. This is about the zero prevalence study. It's at the national level. If you see, this is the zero positivity in sheep, and this is in goats. The major zero positivity about brucellosis in sheep is in Karnataka, Andhra, Gujarat, mostly in southern states. And in northern states, again, it's in Uttar Pradesh and Haryana, you have higher zero positivity. Almost same in case of goats as well. The Karnataka, Andhra, Telangana, and Gujarat in Maharashtra in southern part, Gujarat in western part again. So in northern states, it's Uttar Pradesh and Haryana have higher zero positivity of brucellosis in sheep and goat. Again, transmission. So the routes of transmission we can classify into foodborne, direct contact, and person to person. In case of animals, it is mostly through oral spread of contaminated pasture, or even through the venereal route from the infected males. But for the humans, it is mostly through consuming unpasteurized milk and milk products, and also consuming undercooked meat. Sometimes even through inhalation route and abraded skin also the brucella can enter the body. And again, direct contact with infected animal, aborted fetus and fetal membranes. And again, person to person, although it is rare, some cases of in case of human, sexual contact and organ transplantation and breast milk has also been reported in few cases. But the major, as I told, direct contact and foodborne are the major route of transmission to humans. Again, which are all the high risk group: farmers, veterinarians, butchers, so who slaughter animals. Again, the hunters, tourists. So it happens like the people will go to, especially in Middle East and in other Turkey, and so there is habit of consuming the cheese from goat milk. So usually whenever the tourists go to new places, there is always a tendency to eat something new or a delicacy type. So if those products are not prepared from a pasteurized milk, so there is high chance that these tourists can get infected. So that's why the tourists have been included as one of the high risk group for acquiring brucellosis. Next, again, laboratory personnel, as I told, whenever there may be for the preparation of diagnostics or preparation of vaccines, people may be involved in handling live brucella cultures. So they are also at a higher risk of getting brucellosis. Again, clinical symptoms. Usually in case of those which are not sexually matured animals, usually it's not a major disease. But when in case of sexually matured animals, abortion is the main symptom in case of sheep and goat. And again, retention of placenta, infertility, and in case of males, it will be orchitis and epididymitis from the rams or the boars through Brucella ovis. In clinical symptoms in humans, so usually it starts with fever, headache, and body ache. So, and there will be sweating in the night. So after that, it will progresses into spondylitis, arthritis again. Sometimes there will be complications like it may even cause inflammation of the brain as well as heart. So we usually have some of the cases have been diagnosed actually as neurobrucellosis in case of NIMHANS, so National Institute of Mental Health and Neuroscience, which is there in Bangalore. So they have also reported like certain of the patients with neurological symptoms had this brucella infection. And in case of females, there may be abortion as well. If you see the severity in zoonotic brucella species like Brucella abortus suis, melitensis, the melitensis is the one which can cause highly pathogenic and virulent species to humans, followed by Brucella suis, and the cattle and buffalo species, that is Brucella abortus, is less pathogenic or less virulent in case of humans. So even it is the same scenario in worldwide. It is mostly Brucella melitensis, which is a major cause of brucellosis in humans worldwide. And again, samples which has to be collected for laboratory diagnosis are from animals. You need to collect blood and serum, aborted fetus and fetal membranes, and milk for the milk test. In case of humans, it will be blood and serum. If it is a neurobrucellosis kind of symptoms, then CSF also can be collected. And laboratory diagnostics, what we usually use is isolation is the gold standard, but most of them it may not be possible. So usually serological diagnostics is relied, especially like RBPT, SAT, ELISA, fluorescent polarization assay, and PCR for the detection of the species of the brucella. Again, prevention and control, the most important is to eliminate infection actually in case of the animals. So once there is no source of infection, like in case of animals, so there is a great chance of reduction of the risk to human transmission. So that's why now we have a National Animal Disease Control Program through which cattle and buffalo have been covered in brucella control program. Unfortunately, in case of sheep and goat, we don't have a vaccine yet, not to be practiced. Maybe in future it may come up. So other prevention control for the people include proper handling and disposal of fetal membranes and aborted feces, the cooking and pasteurization of milk and meat before consumption. And again, for the vets and para-veterinary staff, better to wear personal protective clothing whenever handling reproductive issues, maybe like dystocia, abortions, or retained placenta cases. So it's little better to take care during those events. And again, one more important zoonotic disease, which is a priority zoonotic in India as well, is leptospirosis. Again called as rat fever also, because rats are the major reservoir for the leptospira. So again, as I told, etiology is genus Leptospira, and there are more than 30 serovars which is there, which have been divided into 30 serogroups. Wild and domestic animals and rodents are the major reservoirs and carriers for the Leptospira, and the species which is more important is the Leptospira interrogans. So in case of animals, mostly leptospirosis infection is most of the times it will be subclinical, but of course there are clinical infection as well. So once the animals recover from an infection, or if it is subclinical, so they may excrete leptospira for a long time in urine. So that's one of the important risk factor for human infection. So outbreaks are usually seen around monsoon, but as in India, sporadic cases can be seen throughout the year, but majority of the cases can happen during monsoon because of floods. So as I told, these infected urine from the animals may contaminate the flood water, and when people come in contact with flood water and soil, or even in case of paddy fields, sugarcane fields, so through skin cuts, the leptospira can enter human body and subsequently can cause the disease. So this is the transmission routes I was telling. Humans can get the disease with either through direct or indirect contact with the infected urine or contaminated tissues while handling, maybe during postmortem or slaughter process, and venereal transmission in animals. And again, third one, even drinking contaminated water and food. Mostly this happens whenever there is a flood, landslide, when people will have will not have access to proper potable water. So in such cases, even in such scenarios also the disease can happen. So as I told, usually the rodents, the rats and mice, these are the ones which are of the carriers, which will be asymptomatic, but they will pass the leptospira through urine. So either these urine either can directly cause disease in humans through contaminated water and food, or first it may spread the disease to the wild animals and domestic animals. So as these animals recover, or they may be subclinical, through the urine, again it can get transmitted to humans. So again, high risk group, dairy farmers and milkers, slaughterhouse workers, veterinarians. So other than this, people, agriculture workers, like those who work in rice field, sugar cane field, and those people who clean the sewage, the gutters, and mining people, and those people who clean the drainers, adventure travelers, again, as I told, those who explore into caves, river water rafting, and those who involved in water sports, as I told, through water contamination. So they may also get the disease. Again, military and civil emergency personnel, as I told. So many of the times, in case of floods, landslides, and all, army or military persons and disaster relief workers will be called in for the purpose of disaster relief works. So in that cases, they are also at higher risk of getting leptospirosis. So if you since we are speaking with sheep and goats, so this is actually this report of leptospirosis seroprevalence and the serovars which are present in different parts of India. Some of this work has also done from Nivedya as well. If you see the seropositivity as high as 36% has been detected in sheep and goat in several parts of the India as well as from Andaman Nicobar as well. We have also conducted our senior actually, Dr. Bala Murugan and his team. They have conducted a seroprevalence study in sheep and goat for leptospirosis in southern states, including Kerala, Tamil Nadu, Andhra Pradesh, and Puducherry. So you can see there is a high level of seropositivity of leptospirosis in these animals, sheep and goat, starting from 24 as high as 62%. And it actually, it was in the study, it was found that high seropositivity in sheep when compared to goats. And predominant serogroups are Ictohemorrhagiae, Javanica australis, Hospiters, and Pyrogenus. So Ictohemorrhagiae could be one of the zoonotic leptospirosis species. This is for your information, because leptospira sheep and goat can be a carrier as well for the, and they may act as source of infection for humans. Again, the clinical symptoms, if you see, initially this also starts as a flu, because most of the diseases, even for that matter, dengue and other diseases will have similar symptoms. Initially, there will be fever, headache, then there will be sometimes there will be muscle pain. So which are all overlapping. So sometimes there will be some delay may happen in identifying the disease. So when there is a delay, there is possibility that the disease can progress and it can affect liver and kidney. So in that stage, there will be jaundice and yellowish discoloration of the sclera and cornea. So even still, if it further proceeds into advanced stages, there will be gastrointestinal bleeding can happen. So, and again, it leads to bloody diarrhea. So in the final stage, if treatment is not done at the at the proper stage itself, so the patient again progresses into multi-organ failure and death can happen. So usually these human leptospira cases, most of them have been reported from the coastal India actually. So starting from Gujarat, Maharashtra, Karnataka, Kerala. So wherever there are coastal districts, that probably the most the conducive environment for the leptospira survival, and many of the cases have been reported, including deaths, especially from coastal districts of Karnataka like Dakshina Kannada, Udupi, Uttara Kannada, and from Kerala as well. So mostly during the flooding season, that is during monsoon. And again, in case of clinical symptoms in sheep and goat, usually it will be subclinical or acute, but it can even cause pyrexia, jaundice, anemia, hemoglobinuria, diarrhea, and mastitis in case of dairy goats. Even it could be one of the cause for abortion as well. So in case of sheep and goat abortion, leptospirosis may be considered as one of the differential diagnosis. Sometimes mortality in case of lambs and kids can happen if it is severe. And samples, if you are collecting for laboratory diagnosis, the blood, it can be collected both in same from animals and humans, same sample. Urine sample, midstream urine, because as I told, even in case of humans and animals, urinary excretion is there. In case of humans, if you are collecting the urine for leptospira diagnosis, usually it will be after 10 days. Initially, up to 8 to 10 days, you can get it in blood. So, but after that, leptospira disappears from the blood. You may not get it. So usually it will be there in the urine. So after 10 days or 8 days, somebody has to collect urine for the diagnosis of leptospira if the case is already delayed. Sometimes cerebrospinal fluid in case of neuroleptospirosis. Milk can be collected, and if it is a postmortem, again kidney, liver, and spleen can be collected for the purpose of isolation. Laboratory diagnostic test which we use it, for the purpose of information of you people, Nivedi is one of the referral laboratory which is doing diagnosis for both animal leptospirosis and human leptospirosis. Dr. Balamurugan is the one who is working on it. So we usually we receive a lot of samples of humans from integrated disease surveillance program for the purpose of diagnosis of leptospirosis. So what the diagnostic facility we have is we have dark field microscopy for the examination for the demonstration of leptospira, and we do MAT actually, microscopic agglutination test, which is very specific for the serovar detection. So we for your information, ICR Nivedi is actually maintaining 31 different serovars of leptospira in leptospira laboratory. Important again is next is isolation. ELISA can be done for the detection of antibodies, and again we do PCR for confirmation. And again, prevention and control. So as I told, it's mostly through contact with contaminated water and soil. So one has to take sufficient precaution, like the wearing shoes during flooding, so not to avoid coming in contact with the contaminated water. So, and again, rodent control, as I told, rodents are one of the important reservoir. So proper disposal of the waste actually, especially garbage and other food waste should be disposed properly, so that we can prevent the rodent menace. Immunization of animals, actually in large animals and small ruminant, as far as I know, it's not being practiced, but mostly it's restricted to the dog and cat. Chemoprophylaxis, actually this they practice in Kerala during flooding season. So once they come in contact with the flood, actually within 15 days, they recommend to go for a dose of doxycycline as a prophylaxis. And again, awareness creation, because people may not know how the disease get transmitted to from animals to human. So we, the veterinarians, should create a lot of awareness among livestock owners, and again other risk groups like children's regarding this transmission of the disease, so that the risk of the transmission we can reduce to them through awareness. Again, important Crimean Congo hemorrhagic fever. This I just taken it because sheep and goat, not exactly it gets transmitted from sheep and goat, but high seropositivity has been detected against this virus in several states of India in sheep and goat. So that's the reason bringing CCHF for here. This is actually the Nairoviridae family. The Nairovirus is the genus, and the virus which causes CCHF is the Crimean Congo hemorrhagic fever. So the disease was actually the first detected in humans in Gujarat, actually, when it took place in the form of an outbreak. So later on in Gujarat and Rajasthan, several seroprevalence studies were conducted to identify the source of infection. So from where it might have come. So they identified, they did actually seroprevalence study in several livestock species, cattle, buffalo, sheep, goat, and they could detect seropositivity in cattle, buffalo, sheep, goat. So this can be one of the virus which may be there in sheep and goat as well, in other part of India as well, that is not yet known. The disease is very highly fatal. The case fatality rate is up to 80% if it is not treated in at a proper time. So it's mostly the distribution. If you see, it's there in the Middle East, even in Asia and certain parts of Europe. In mostly in human cases in India is seen from Gujarat, and cases from Rajasthan and UP. So these are the states, and other states, although seroprevalence has been detected in animals, human cases have not yet been detected for CCHF. So regarding transmission, actually, if you see, this is mostly transmitted by tick bite. Okay, so or through direct contact with the people who are already infected with the CCHF virus, or direct contact with the animals or the animal carcasses, blood and tissues, which if the animals are infected. Okay, so usually the ticks of the species Hyaloma are the major vectors for the CCHF virus. So for between animals to animals and animals to humans, through bite of the ticks, this virus can get transmitted. So other than that, as I told, the close contact with the animals is one more route. So the domestic, the animals, although in India, exactly the reservoirs of animal reserves have not yet been detected, but from zero prevalence study, so these are the main domestic animals in which zero prevalence has been detected. That is cattle, sheep, goat. So the viremia will be there in animals, but the thing is, most of the animals may not show symptoms for CCHF. So it's very difficult to suspect an animal whether it has been infected with CCHF virus or not. So that becomes a difficulty in early identification. So again, risk groups, as I told, farmers, slaughterhouse people, and veterinary staff, medical staff. As I told, this disease can be transmitted from nosocomial infection. Means those patients which infected with CCHF through their excretion and secretion, like blood, urine, the virus get excreted in large quantity, and the medical staff, nurses and doctors who come in contact with can get the disease. As I think you might have read, like in Gujarat, actually, in the initial outbreak in 2011, even the physician and the nurse who was treating the index case of the patient also succumbed because of CCHF. So one has to be careful even in medical facilities as well. Laboratory workers, as I told, because those people will be handling specimens. So there's probably that they are also at a higher risk of getting the disease. So this is actually a map which I taken from a study from NIP. They have conducted zero prevalence study in case of animal against CCHF virus. So if you see, it's almost in all the states, zero prevalence has been detected in bovines. Okay, but when it comes to sheep and goat, it's only in few states actually it has been detected. But it's actually done in the year 2015. After that, there are few studies probably in which also shows that in other states also probably the sheep and goat might have been there. So why I brought this in CCHF in here, because currently the exact source we don't know. So it has since we have seen high zero prevalence even in sheep and goat as well. So it's highly probable that may act as a source of infection for humans. So one has to be, whoever dealing with even with sheep and goat also, better they should be of aware so that this disease transmission we can avoid. Again, clinical symptoms in humans. In the initial stages, it will be sudden onset of fever, headache, sensitive to light, and back pain. As you can see, these most of them are non-specific. That is one of the reason why usually suspecting for such disease will get delayed. So in other place, in endemic states, definitely if such symptoms are there, definitely they'll suspect. But when it happens outside the endemic areas, it becomes difficult in suspecting for CCHF. And again, when the disease progresses, it leads to jaundice, changes in mood, and more importantly, it causes bleeding tendencies. So the bleeding in multiple organs and in gastrointestinal tract, so that that leads to bloody vomition, bloody diarrhea. So and people will end up in shock and death. So these are the symptoms in humans, and as I said, in animals there are hardly any symptoms which are affected with CCHF, mostly asymptomatic. So that we should remember. And prevention and control, as I said, it's mostly the tick transmitted. So most of the preventive measures will go towards tick controls. So like wearing protective clothing, applying acaricides on skin and clothing, frequent examination of clothing of and skin for the presence of ticks if you go into the tick infested areas, and apply like tick control measures like maybe the flame gun burning or use of acaricides for killing of these ticks in case of the sheds. And it's better to avoid areas which are infested with ticks. That is about the tick control measures. And again, reducing risk from animal to human transmission. So as I told, in endemic areas, especially handling sick animals or while conducting maybe post-mortem and other procedures, veterinarians and paraveterinarian staff, it's wise to wear protective clothing, and treatment of animal with acaricides is one more important the preventive measure. And again, reducing risk to human transmission in the community. This is mostly in the houses where the CCH of patients are there, or even in case of hospitals. So it's important that they should take proper care while handling or when they are in dealing with people who are infected. So this is about prevention and control of CCHF. In toxoplasmosis, this is actually not well studied in India, I should say, but the more research has taken place in abroad. So and toxoplasmosis is one of the important differential diagnosis if we are suspecting abortion in case of small ruminants. Toxoplasmosis is caused by Toxoplasma gondii, which is an intracellular protozoan pathogen. Usually the definitely host will be cats and members of the Felidae family. So usually etiology, as I said, the Toxoplasma gondii is the etiology for toxoplasmosis. Cats are the primary host for the Toxoplasma gondii, means that it is the definitive host, and cats excrete oocyst of these Toxoplasma gondii, which will contaminate food, water, and the pasture which the animals eat. So subsequently, when people consume or when animals consume the pasture, they get infected with the Toxoplasma gondii. Most of the symptoms initially it will be flu-like, as I told, fever, headache, myalgia-like symptoms. So, but this disease, the thing is that in immunocompetent persons, this is not a major threat. But in immunocompetent, compromised persons, like people who are affected with AIDS, those people who are under immunosuppressive medications, like those who undergone transplantation, organ transplantation, such people, this is actually a little severe disease. So a little bit about how the disease transmits, that is transmission cycle. As I told, Toxoplasma gondii is a protozoan parasite protozoa. It will be there inside the intestine of the Felidae family, mostly in the domestic cats as well. So usually through feces of the cats, the oocysts get excreted. So when this oocyst excreted in feces may contaminate water, other vegetables. So humans, when eat these vegetables or when they drink contaminated water, so humans will get the Toxoplasma gondii infection. So similarly, when this kind of oocyst when contaminate the pasture, so through the pasture again, these herbivores will get the disease. Okay, so humans, there is one more route of getting toxoplasmosis is through consumption of the meat of undercooked meat of these domestic animals. So once the oocyst has been eaten by these animals, the oocyst get converted into releases sporozoites, and they form tissue cysts actually. So in the meat of these animals, bradyzoites will be there. So when humans will consume the meat of these domestic animals without proper cooking or raw meat, so humans get the disease. So humans, once again, I will just explain, gets with the two routes. One is through contaminated food and water, which is having oocyst, or the second route of transmission is through consumption of undercooked or raw meat, which is having tissue cysts. So again, in case of from mother to children, again vertical transmission is possible. So if the mother is infected for the first time, they say, if it's a primary infection, so if the pregnant mother get infected when she is become pregnant or just before pregnancy, so transplacental transmission can take place, and it can cause a severe congenital malformation in the fetus which are born. Again, in case of through organ transplantation, blood transfusion, also the disease can get transmitted. In case of sheep and goats, usually the majority of the symptoms are related to the reproductive problems like abortion, mummification, and stillbirth. Kids will be there, and again, in some of the animals there may be lymphadenopathy, diarrhea, and weight loss can take place. In case of humans, actually it's a more important in humans, it's because in immunosuppressed patients, it can cause severe symptoms like confusion, headache, seizures, and in case of pregnant women, it can even lead to miscarriage, stillbirth, and congenital malformations in case of children which are born live. So usually in children which are born live to an infected mother, so they may have damage in the retina, hydrocephalus, or even the intracranial calcification also. So it's a bit very tragic disease in humans, we should say. Again, for diagnosis, for confirmatory diagnosis, we should demonstrate histology in tissues, especially aborted fetuses, organs of the fetus, placenta. Serological diagnosis also possible, but mostly it is the serological diagnosis in case of humans. And again, molecular techniques to determine the to which clade or the genotype the Toxoplasma gondii belongs to. Again, for the prevention and control, as I told, mostly since it is foodborne transmission is very frequent, one has to cook food thoroughly, especially the meat from the domestic animals. And not only that, even for the vegetables and fruits as well. So they have to be thoroughly washed. If at all they are contaminated with oocyst, so that thorough washing can take them off. And personal hygiene again. So whenever they were handling soil, any gardening related activity and all, as I told, fecal contamination from the cats can contaminate soil. So the oocysts are always there in the soil. So one has to take care while gardening, like wearing protective gloves, washing hands after handling soil. And as far as possible, pregnant women, better they should avoid changing the cat litter or coming in contact with cats. And better keeping the cats indoor is one more important, because the cats, which if they consume any rodent or small mammals for that matter, if it is infected with Toxoplasma, dogs can get the disease, and again after that they excrete oocyst, which is again a threat for the human health. So these are some of the important preventive and control measures which we have to take against toxoplasmosis. And there are some other diseases, actually those are the major diseases which we covered, but these group diseases I just grouped into one group, because mostly these diseases are transmitted through oral route of transmission, that is fecal-oral, and mostly related to gastroenteritis symptoms like Salmonella, E. coli, Campylobacter, Giardia, and Cryptosporidium. So this, as I told, it's mostly contact with infected animal feces, or the animal, the water which is contaminated with these organisms, when whether the animal or human, when they consume. So these are the disease will appear. So the symptoms usually, as I told, mostly gastroenteritis kind of a symptom. But in case of Campylobacter and Salmonella, in case of animals, they may even lead to reproductive losses like abortion and birth of weak lambs, neonatal mortality. And otherwise, the Campylobacter and Cryptosporidium, mostly they cause diarrhea, decreased body weight gain, and death. In case of humans, usually, as I told you, these are all the affect gastroenteritis symptoms. So abdominal pain, diarrhea, nausea, fever, and headache will be there. But especially if it is E. coli O15H7, which are all toxin producing E. coli, this is of a little bit severe disease which causes bloody diarrhea, and which leads to again kidney damage through toxins. So in those persons, a syndrome called hemolytic uremic syndrome will develop. So even if it is not treated properly or taken care, it may even lead to death. So these are all mostly foodborne bacteria or pathogens. And again, others diseases which can get transmitted from sheep and goat to humans through close contact, usually the ORF, which is parapox virus, and some of the fungus, which are dermatophytosis, scabies through mites. Mostly these infection, both in animals and humans, are related to superficial skin lesions and dermatitis. These are the references which I referred to prepare the PPT. I also thank some of my colleagues, Dr. Bala Murugan, Dr. Nagalingam, and Dr. Manjunath Reddy, and others who actually provided inputs from their research area like brucellosis, leptospirosis, and etc. Thank you very much.